So as a scribe, in my given average day, you'll see about probably anywhere from 15 to 30 patients in an 8-hour span. And essentially you follow a doctor around and you chart for them. But it gets a lot more complicated than that because you do all of their documentation, but you also want to help them order labs and help them do discharge instructions and keep them up to date with results. I had already done a master's program the year before, and I've done a lot of other lab work, bench work, and I've done volunteering, things like that, and I wanted to do something that had even more clinical experience, I guess. But this job probably is great because it gives you the closest, like, first-hand account, the best clinical experience you can possibly get without actually being in medical school, because you get to see patients one-on-one, you get to talk to your attending physician one-on-one, and you get to pick their brain about, you know, how diagnoses are made, what labs are ordered, why they're ordered, and it's just really great first-hand experience. I think one of the harder things with scribing, especially at first, is to be able to multitask and take on. It's a very fast-paced environment. Especially sometimes, you know, you could be seeing several patients in a given hour, and you kind of have to be on top of things. You have to be able to keep track of all the different labs and orders that are done, and the histories and the charting, and it can get a little hectic, but it's also especially rewarding if you can keep things going and keep things moving. But that initial transition is a little bit. I think anybody, you know, even if you're not interested in emergency medicine, anybody who's interested in medicine and wants to get better exposure with patient interaction and, you know, being able to talk to doctors directly should do a program like this, because you really get a first-hand account of just how medicine works clinically, you know, on a day-to-day, you know, real-time basis. You get to see the procedures, you get to see the labs, the orders, you know, you put them in yourself, and you get to see the results sometimes even before the doctors see them. And from there, you know, you get so much clinical experience. It's like, I mean, you're not a resident and you're not a medical student, but you probably get just as much exposure to the situations as they would.